Our next speaker is going to be talking to us about the experience in Barcelona and the personalised and predictive approach they have. And I'm going to invite Ester to come to the stage to talk to us. Ester.
Hi, good morning, everyone. Thank you for joining us here today. So, as Paul introduced me, what I'm going to be presenting during the following 20 minutes is a journey. It's a journey with the telecare in Spain, with Barcelona as a case study, but more generally speaking, as how telecare has been progressing and ourselves, how we've been contributing to defining this personalized, proactive, and potentially predictive telecare model in Spain. So, as it is a journey, I wanted to start sharing with you. I was here in TSA conference in 2015. At that point, I was working for the government. So we came for the Catalan government, the regional government. So we came with one of our Tunstall's current customers with the Barcelona provincial government. And we came here to present how was the integrated care policy in Catalonia, how technology was enabling that transformation. And I'm glad to say that what we presented at that point, that it was this proactive telecare model, and the challenges we identified at that point in 2015 are the challenges. So we've done quite a lot of progress on those challenges that we already identified in 2015. So from 2015 to today, a lot has happened in telecare in Spain. Actually, we've had quite a lot of interest from the UK, so maybe thanks to Paul media activity, but also from events like TSA and the work from our colleagues here in the UK. But locally, it's been a great journey, the one where we've been involved in the telecare area. So I'm sure you are aware that normally in most of the European countries, telecare nowadays is still a quite reactive service. A service where people request for an emergency answer when they have an issue. But in Spain, it's not like that anymore. So telecare service was established in 1994. I won't stop, so I won't dedicate too much time on that because I assume that I already presented different times here in the UK, so I guess you are pretty much, or you can be pretty much aware. So 1994, telecare service was established. At that point, the priority was to spread the coverage, so to gain the most of the users that was possible. But in 2000, actually that service became a proactive service. And it was thanks to a very strong political leadership. They defined that minimum requirements for proactive services. So we must organize a service that we could provide outbound calls, we could provide some limited, but some home services support. So the value there was to increase the volume of resources dedicated to the telecare services. 2010 was a moment where we started improving the quality of the service. So actually, 2010, the service, telecare, was in fact a proactive service, but it was not enough being proactive. We needed to provide valuable content to those proactive calls, to those proactive visits, to all that activity that we were providing. So we started with, together with our customers, we started designing care programs, what was more valuable to provide healthcare advice with our proactive calls, or security advice, or public campaigns, or support when there was a heat wave, or whatever. So the priority there was improving the quality of the programs delivered. So actually, 2015, when I was here, we were at that stage. So we were providing a very nice, proactive telecare service. But from our perspective, it was not enough. So last year, 2017, we give a little bit more an effort from us and our customers to be able to build a personalized telecare in addition to the proactive. So it was not enough providing the proactive. We needed to provide the right care for the right users in a way to make sure that we were efficient, but also to fit the service to the users' needs. And just to give you, so what that means for the users, and we've been working on different assessments, external evaluations from that model. What that means for the users is that, so first we had a linear model of care, but now all the users that are, depending on the customers, of course, because they decide whether they want to implement that or not. But so we do a first assessment to each of our users, and according to that assessment, every user receives the right telecare, so the appropriated telecare. And that means the intensity of proactive care, the kind of support programs we are providing, the additional technology, if they require technology that it's accessible for some impairments or whatever. So we've been working with that from 2017 on, and I want to show you some features. Just you can have an overview on what's the impact of that journey. So you see that number of users during that period has been increasing. So our customers have a strong commitment of using telecare as a service to prevent so the evolution of higher risk, higher needs, higher users. So the users have been increasing, but even that, the income calls are stable. So you can see on your left that even the increase in the number of users, what has been increasing is our outbound activity, not the income activity. So you can see here, so from the total volume of our activity in telecare, not only the contact center, but also the home services we do provide as part of the telecare, you can see that only 30% of our activity in 1 year is income call, is emergency care. The rest is we providing proactive service. So that's quite relevant for us because it makes the service significant in a continuous way for the users, not only when they have the issue that they require support, that we do provide that as well. And regarding the personalization, so that was on the proactive. But regarding the personalization, so from now in Spain, we do manage the service for 300,000 users, over 300,000 users. The users that have been already assessed in the RED model, RED stands to Efficiency Telecare Response. That is a registered model by us and validated through the Autonomous University of Barcelona. So that RED model, we've already assessed 88,000 users, and I just put here some of the answers regarding this first assessment. So how do they perceive their self-health, the self-perception of health? Sorry, how many times they've fallen last year? How many people are often visiting them? So obviously, having this picture from our users, it's quite easy to then provide a personalized support, whether we need to call every 2 weeks, every week, or it's too much and we are just disturbing the users and being overprotective with them. So last graph I wanted to share to you was the impact it had, so this proactive and personalized model, the impact that had on the length of stay. So our users from 2010 to 2016, they are staying in using telecare for a longer period as the time goes on. So now there's an average of 4 years, 33, so 4.3 years. And you can imagine the impact that this is having on, for example, the use of more intensive services as home care or residential care, the impact that it's having in acute hospital care or emergency admissions. But more importantly, the impact that this data, this value is having on fitting users' values and preferences and needs. So it's not only about delaying the need for being admitted in a nursing home, that's obviously have a big impact on the system, not only avoiding or delaying the need of receiving a big number of hours in home care, that it's also relevant for the system, but providing the right care, the care that the user wants to receive. So they can stay longer at home, they can stay with their community, they can stay with their relatives. So that's what we are implementing now. But we don't have enough with that. So now we are moving. So we don't have enough with a preventative, proactive, and personalized model. Now we want an advanced health and care, so an advanced telehealth and care service. And we are lucky that the central government adopted a regulation early this year on the advanced connected health and care services. This definition, in general, assumes what is already the telecare, the proactive and personalized telecare in Spain, but it adds some very relevant content. And the relevant content that this definition is including is the one that has to do with health. So obviously, telecare until now in Spain has been very much looking into the social care domain of that care. But now with this new definition, some of the contents that are being included are more related on health management. So healthcare programs and end-of-life care, so how telecare can support this specific period of end of life. So how we can detect and prevent cognitive impairment or deterioration from telecare. How we can integrate telecare, you can see it, I don't know if I have, anyway. You can say, how do we integrate our telecare solutions to the electronic health records, and we use that valuable data that we are managing internally? How do we include health clinical telemonitoring as part of the telecare program? Because otherwise, it's quite difficult to move that piece from pilots and trials to a sustainable and scaled service. So this is being progressively adopted in Spain. So quite a lot of very interesting initiatives are happening currently now. You can see here, so many regions in Spain are using the CPI, Innovation Public Procurement, to start discussing and to start innovating in the service delivery. So we have Catalonia that in our telecare contracts, they are including health telemonitoring programs. We see they are discussing on how they should be advancing on the health and care, telecare service, sorry for that. And I just wanted to highlight a couple of them, being conscious of time. So one that I think is quite interesting is what's happening in Galicia. In Galicia, for example, you can see, and that's not on service provision, but you